right. Hello, everyone. Welcome back to Plant-Based Kidney Health. My name is Michelle Crosmer. I'm a renal dietitian, and I am here again with Dr. Sean Hashmi. And we are going to be talking today about vitamin K and specifically vitamin K2 and how that relates to kidney health. How are you doing today, Dr. Hashmi?
I'm doing well. How are you?
I'm doing pretty good. I am ready to dive into this topic. I know you have some episodes on this on your other YouTube channel, and we get a lot of questions about this in our Gmail as well as on comments on YouTube. So let's get started. Since again, I feel like every week we say this, there's a lot to talk about. There's a lot to break down. But what is vitamin K and what is its role specifically in kidney health?
Yeah, great question. So, vitamin K and K2 is a question that comes up a lot. And vitamin K, which is the big name for both of these vitamins, it's a fat-soluble vitamin. It was first found in 1936. Some folks say earlier. It doesn't really matter for our purposes. But what does matter is that there's a number of isoforms that you want to know about. And those isoforms are what really tell you about vitamin K. So, if you look for a supplement, for example, sometimes you'll see they use these isoforms. So for all of our audience, you want to know phylloquinone is vitamin K1. So that's with a P, phylloquinone. When you talk about menaquinones, those are vitamin K2. So menaquinone is K2, phylloquinone is K1. Now, when it comes to K2 or menaquinone, there's a few subtypes that get thrown around. And these are important to understand, specifically MK4, MK7, MK8, and MK9. These are all vitamin K2s. Now, which one is the one that you want to know the most about? It's MK7. And the reason is because MK7 has the best bioavailability of all of the menaquinones out there. So in other words, if you get a supplement for vitamin K2 and it says something like MK4 or MK9, then you're actually wasting your money because it's not going to get absorbed well. You want it to say MK7. So MK4 has very poor bioavailability. So if you take it, what we see in studies is that it doesn't raise your blood levels of vitamin K2. Same thing with MK9. MK9, even though it has a very long half-life, it's also very poorly absorbed. So bottom line there is MK7 is the subtype of vitamin K2 that you want to look at if you're going to go ahead and supplement. Now, with that being the case, let's talk a little bit about what is this hype about vitamin K2? What are the benefits? Why should you care? So specifically when it comes to kidney disease, for example, there was a study in Kidney Blood Pressure Journal back in 2016 where they talked about this thing called DPUC MGP. It's a very large word, but it stands for dysphospho-uncarboxylated matrix GLA protein. Why should you care about this really long word? Is because it's positively linked to spilling protein in the urine. So in other words, the more of this DPUC-MGP you have inside your blood, the more likely you are to spill protein in the urine, the more likely you are to see your creatinine elevate. We had done an entire episode talking about phosphorus and parathyroid. This will make your PTH go up. And on the flip side, it's negatively linked to things like your hemoglobin count, that's how much blood you have in the body, and your albumin level, which is how much protein you have in the body. So in this particular study in 2016, what they showed was that 90 micrograms, very low amount, of vitamin K2 supplementation actually resulted in a 10% decrease in this DPUC-MGP. And the reason we care is because with that decrease, you're also looking at less calcifications going on. You're looking at less activation of parathyroid. You're looking at less worsening of kidney disease. So for kidney disease, there is a role specifically for vitamin K2. So remember, K1 acts inside your liver. K2 acts everywhere but the liver. So what we really care about is K2 because it's going to be everywhere. Now, in kidney patients, the number one cause of death is the heart. So specifically, they get plaques and they get stiffness and so forth going on. So when it comes to arterial stiffness, there was a randomized double-blind, placebo-controlled trial where they looked at healthy postmenopausal women. And basically, this trial went on for 3 years. And what they were looking at was how stiff their carotid femoral pulse wave velocity was. In other words, if you have a blood vessel that's very stiff, it's like when you squeeze a pipe, the water goes to it faster, so you can tell if the velocity is coming faster, it's getting nice and stiff. But if it's slower, there's flexibility left in there. So they saw that the stiffness was actually decreased in the group that actually got about 180 micrograms of vitamin K2. Once again, another study with very low dose. Even when it comes to heart disease, there's the Rotterdam study that was published back in 2004 in the Journal of Nutrition, and it was a prospective study. And what they showed was that the aortic, your main blood vessel, the aorta, the aortic calcification was actually decreased at the root, where in other words, where it just comes out, by about 52%. So another reason where vitamin K2 is really good, especially in kidney patients who are prone to heart disease, is this whole concept of vascular calcification going on. Now, we know with our kidney patients, they get bone health issues all the time. They get renal osteodystrophy, or they get the soft bone disease going on, and either one was more likely to break. So it's not just osteoporosis, but it's bones that instead of forming nice, tight junctions, so to speak, they kind of have this weird pattern to them, and that's the osteodystrophy portion. So in this particular one, there was a meta-analysis done in 2006 in the Archives of Internal Medicine. And what they showed was that vitamin K2 at about 45 milligrams, remember we've been saying micrograms up until now, but this was 45 milligrams per day. It reduced hip fractures by 77%. It reduced vertebral fractures by 60%, and it reduced non-vertebral fractures by 81%. Why should you care? Because in countries like Japan, for example, vitamin K2 is actually used as part of osteoporosis prevention. So another reason it's good. Now, the number one cause of kidney disease is diabetes. And what's fascinating about vitamin K2 is that it decreases the risk of diabetes by 7%. And this was based on a prospective study based on Dutch men and women that was published back in 2010. And the way that we're able to tell if vitamin K2 is increasing in the blood is we don't have very good tests to measure directly, so we use a marker called osteocalcin. And osteocalcin is able to show, when it's higher, it's able to show that there's more vitamin K2 going on in there. So that's how we look at it. There's some really fascinating data when it comes to things like liver cancer, specifically hepatocellular carcinoma, where the risk of recurrence is dramatically decreased. And there are studies that have been published on that as well. In one of the studies was published in JAMA in 2004 going on. We know that in our renal population, in our kidney patients, brain health, because things like dementia, things like memory issue, all of these things because of chronic inflammation is a very big deal. So in PLOS One in 2020, there was a study where they were looking at animal models. And what they showed was that by giving them vitamin K2, they were able to improve the short-term memory, despite the fact that they actually caused them to have ischemia. It's a terrible thing to do to animals when these studies are done. But what they did was they actually decreased the blood flow to the brain in these rats. They caused them damage. Then they allowed the blood flow to return. And the mice model that were getting the vitamin K2, they showed that there was an improvement in their memory going on compared to the mice that didn't get the K2. So it's pretty fascinating that in terms of not just short-term memory, but spatial memory, and looking at all the different types of memory, they were all preserved when these mice were actually given vitamin K2. Now, these were very high doses. And then lastly, when it comes to obesity, even when it comes to weight, there's some really interesting data on vitamin K2 where it's linked to, now this is linkage, not looking at anything else, but it's linked to decreasing abdominal fat mass and the type of fat that we worry about, which is the visceral fat. And that's seen at doses, once again, in the microgram dose. So one of the questions always is, well, what's the right dose? The answer is we don't know because nobody has established an RDI for vitamin K2 yet. But as we answer some more questions, I'll give you sort of a range where most of the data is seen. So, Michelle, now that we kind of define the role of vitamin K2 and what are some things it's good for, can you tell me, how do people get vitamin K2 from their diet? And really, is there really a difference in terms of looking at vitamin K1, K2? And if we're talking about diet, what the heck should we be eating?
Yeah. So, and you had mentioned, the recommended dietary intake for vitamin K. So that's based around vitamin K1, not vitamin K2. And that's because that's what was studied before, So vitamin K1 is primarily found in plant foods, especially leafy greens, and vitamin K2. And you had mentioned the different forms, the MK4, MK7. But MK4 specifically is found more so in animal products. So things like liver, organ, meats, butter, cheese, things like that. But like you said, MK4 is not as, bioavailable. And we want that MK7 form of vitamin K2. And so that is mostly found actually in fermented foods. So especially like natto or tempeh or miso, sauerkraut, some aged cheeses, that's typically where we find it in food form. And, you mentioned studies in Japan, that's typically where those fermented foods are eaten on a regular basis. And so in our Western diet, Western culture, most people are not consuming natto, tempeh, and miso on a regular basis. And so they're not getting sufficient amounts of vitamin K2 in the diet. Technically K1 can be converted to K2, but it's not very reliable and it's not in amounts that we can say, okay, if we just eat more leafy greens and get more K1, that then we'll get a sufficient amount of K2. So we can't get it there. So the other thing that's important with kidney disease and kidney health that we always have to talk about and think about is potassium. And so if someone is looking to increase K2 from their diet specifically, then it would be increasing those fermented foods. But something like natto, for example, and even tempeh, they are higher in potassium. So the natto is those fermented soybeans. It's about per ounce, it's about 200 milligrams of potassium. Tempeh is about 115 milligrams of potassium per ounce. And again, most people are eating 3, maybe 4 ounces. So that's something to keep in mind that potassium, if someone does need to restrict potassium, that can add up. And so that's where we look at, if you're not able to get it in those sufficient amounts from the diet, then that's where we turn to and we look at the supplementation. And like you mentioned, supplementing with the K2 form, the MK7 of the K2 would be the best form to be supplementing with. And we'll get a little bit more into dosing, but I think that's the hard thing is we need more research around what is the exact amount that's recommended, because again, the RDA or recommended dietary allowance for vitamin K right now that's established for people is based on vitamin K1, not on vitamin K2. So I would say overall, those are the ways you can get more of that MK7 vitamin K2 form. But unless you're regularly eating those fermented foods, then you likely wouldn't be getting enough in your diet. And then you'd want to be looking at supplements. Which I do have a question for you on the supplements, and even before we get into doses and stuff, but why is it that we oftentimes see vitamin D, specifically D3, combined with vitamin K2 in supplement form?
Yeah, this is a really interesting thing. And if you do decide to do vitamin K2, it's always a good idea to get the vitamin K2 with D3 because they actually work synergistically together. So what they end up doing is they'll take the calcium that's being absorbed from the gut. So remember, one of vitamin D's job is to increase the absorption of calcium from the gut. So they'll take that calcium and they'll shuttle it into the bones. Instead, if you take too much calcium, especially if you're a kidney patient, or you're getting too much vitamin D if you're a kidney patient, what you're doing is if that calcium has nowhere to go, it's going to end up in the tissues. It's going to end up in your blood vessels. So one of the concerns we have is arterial calcification, arterial plaques going on, and the stiffening of all of those blood vessels. So that's where K2 and D3 become very, very interesting. So if you take a supplement, look for one that has MK7 and it has the D3 already in it.
Got it. And so what do we know then about doses for MK7 and what someone would want to take if they were supplementing?
Yeah, this is another really interesting question because if you look at the studies, the studies went as high as 360 milligrams per day, and they didn't really see any issues going on. Nobody really knows what the optimal dosing is, but all of those studies that we cited above in terms of the numbers going on and everything, you can certainly look at the dosages that they use, and that's how a lot of the manufacturers are putting the MK7s inside there. You know, I take MK7 myself. I take the one that I actually get from Costco, and I actually shop for everything at Costco, but this particular is the only vitamin K2 that they carry at Costco. So we don't like to bring up any particular brands, but it's hard to miss it. But that's the one that I take myself. It already has vitamin D in there. So I couldn't give you an exact dosage because honestly, it just doesn't exist right now. But really, if you look at the one that's in Costco, for example, that's the one that has data behind in terms of the dosage going on, because some of the studies that were done in osteoporosis had similar dosing to that.
Okay, got it. And should someone, you know, when we talk about someone taking vitamin D, we know we are recommending that they get their vitamin D blood levels checked every, so often, making sure they're not deficient. So is vitamin K2 something that someone can get? Should they be getting like, hey, let me get my K2 levels checked in my blood, or after taking a supplement for so long? Is that something, because it is a fat soluble supplement or vitamin? So is that something where we need to be worried about toxicity or checking blood levels?
Yeah, so first, you really can't check blood levels directly. So the answer to that is you're going to be a little bit in the dark as far as that goes, because you won't be able to know exactly what the levels are. Number two is in terms of toxicity, what's interesting is even in the studies went as high as 360 micrograms per day, which was some of the highest amount that they were using inside the studies. But even at that dosing, they didn't see any side effects occurring. So with K1, for example, of course, if you're on any kind of blood thinner, like warfarin or Coumadin is the other name for it, you definitely don't want to take K1, K2. You want to stay away from that. But on the flip side, if that's not the case, then what you're looking at is we still don't have a lot of info in terms of what would be the side effects. Now, certainly, can it affect you if you're on blood thinners? Yes, it can. Specifically, the vitamin K antagonist going on. But otherwise, not really. The higher doses, like as you approach the 360 or so, if anything, you might have a little bit of GI upset, but that's about the only thing. Now, this is different from all the other fat-soluble vitamins, because the other ones, especially things like vitamin A, for example, can actually have some very serious side effects going on. So a little bit different, but K in general, it is very well tolerated.
Good. That's good to know. And I think, you want to be checking your any supplements that you're taking, of course, with your own nephrologist and your own dietitian, so they can look at those doses and make recommendations. Because again, if you're looking to get a D3 with K2, then you want to both making sure the vitamin D3 is the dose that you need, and that the vitamin K2 is as well. And at least from what I've seen, there's not as many supplements up in those 300 microgram range. They're maybe down like 100, 90, 100, 120, 150, but then that's based on, okay, well, that might be per 1,000 or 2,000 IUs of vitamin D. And so that's where you want to make sure that you're having your dietitian and nephrologist helping you with that correct dose, so you get the right amount of vitamin D3 and the right amount of K2 in your supplement, and that's specific for you.
Yeah, I think that's great. So I think, to sum everything up in terms of vitamin K2, there's a lot of really exciting literature. I don't think it'll be any surprise to anyone if we have some kind of a recommended dietary allowance coming up in the near future around this, because the amount of data that's coming out on K2 is a lot. Number two is, especially if you are somebody who's following a whole foods plant-based diet, aside from the fermented foods, it's really hard to get the vitamin K2. So if you think about it, supplementing is not a bad idea. It's a matter of finding a quality supplement to do. But for that, we don't actually have any recommendations.
Yeah. But yeah, I think that's it that we have for vitamin K2. And again, if you guys can subscribe to our channel, share this, especially again, we got asked this to talk about this topic by a lot of different people. So hopefully you guys find it helpful. You share it. You can submit future questions that you want us to talk about in upcoming episodes to our email, which is plantbasedkidneyhealth@gmail.com. And we will be back next week with episode 20.
Thanks, everyone. Bye-bye.